Hi, I'm Albert Praw, Chair of the Los Angeles Federation. Welcome to the session, COVID-19 and the Jewish Community, Research and Action. Thank you for being with us. Recordings of this session and all other workshops will be available online after the GA ends. I hope you're planning to join us tonight for the Federation Together plenary. We are all looking at data in order to better address the needs of our community because of COVID-19. And that data is here today, and we're going to dive into several recent studies that are very relevant to our communities. Using a national survey, the Pew Research Center has compared US Jews to other Americans on selected economic and health measures. A Brandeis University study surveyed Jews in 10 Federation communities about their experiences with the pandemic. Interviews in the Philadelphia community show how Jews there have accessed help they need. And we also have Federation professionals on hand to give an on-the-ground perspective on how they've used these and other data in their pandemic responses. I'm pleased to welcome our speakers for this workshop. Janet Krasner-Aronson, Associate Director of the Cohen Center for Modern Jewish Studies at Brandeis University. Becca Alper, Senior Researcher at the Pew Research Center. Alan Cooperman, Director of Religion Research at the Pew Research Center. Brian Gralnick, Director of Social Responsibility at the Jewish Federation of Greater Philadelphia. Ilana Horowitz, Past Doctoral Fellow at Stanford University, and Sabrina Townsend, Assistant Vice President of Evaluation and Quality Improvement at Jewish United Fund of Chicago. Our moderator is Lawrence Kotler-Berkowitz, Senior Director of Research and Analysis at the Jewish Federation of North America and Director of the Berman Jewish Data Bank. Lawrence, take it away.
Thank you, Albert, and thank you everyone for joining us today. I want to just set the stage a little bit before we jump into our presentations and let the attendees know what to expect as we move along. We're going to start today with presentations from Becca Alper and Alan Cooperman at the Pew Research Center. They're going to set the national context for us with data that they have from a Pew National Survey. Then we're going to move to a presentation by Janet Aronson from Brandeis University. Janet is one of the researchers on a 10 Jewish community study on the experience of Jewish communities during the coronavirus pandemic. And she's going to talk about some of the highlights from that study. Next up will be Sabrina Townsend from the Jewish United Fund in Chicago. Chicago was one of the communities involved in the Brandeis study. And Sabrina will talk about how the Federation there has used the Brandeis data and some additional data collection and research that the Federation has been doing. Following Sabrina, we're going to switch locales and move to Philadelphia. And Brian Gralnick from the Philadelphia Federation will be speaking about some of the on-the-ground responses of the Federation there to the pandemic. And we'll conclude with a presentation from Ilana Horowitz, who has been conducting interviews in Philadelphia, which reveal how the Jews in Philadelphia have been able to access the help that they need during the pandemic. Following the presentations, we will hopefully have some time for questions and answers towards the end of the session. For those who are attending the session, you'll see at the bottom of your screen a Q&A function. Feel free to send us questions during the presentations. I'm going to try to hold most or all of the questions until the end, unless something really needs to be clarified during the presentations. We probably won't be able to get to all the questions, but we'll select some that we hope will provide some additional insight. So with that, I'm going to turn things over to Alan Cooperman and Becca Alper from the Pew Research Center.
Hello, everybody. Lawrence, thank you very much for organizing this session. I'm going to share a screen with you. And let's hope that it comes right up. And here we go. Good. So by a combination of good planning and good luck, I think we have a variety of different kinds of data and perspectives to share today that with luck will paint a fuller picture of the pandemic's impact than any of us could individually. The data that Becca Alper and I are going to share, it comes from a nationally representative survey of more than 13,000 US adults, which the Pew Research Center conducted in August. The sample includes about 350 Jews. That is a small sample. It is enough for us to break out Jews separately and report on results for Jews alone, but it is not enough for us to look at subgroups of American Jews, such as Orthodox Jews or Jews over the age of 65 or Jews in particular parts of the country. With that said, let's take a look first at what Jews in the survey told us about their experiences with the coronavirus. So I think the big picture here is that Jews have been affected about as much as the US population overall. Jews are somewhat more likely than US adults overall to say that they have tested positive for antibodies, meaning that they had the virus at some point. But Jews are just as likely as Americans overall to say that they've tested positive or actually having the disease. 3% of American Jews say that, which is not statistically different from the 2% of US adults. And if we look at the share of all Jews and all US adults, it's about 1 in 6 or 1 in 7 of all Americans who tell us that they either have had the virus and been tested and formally diagnosed for it, or they're pretty sure that they've had it, even though they haven't been diagnosed. Now, if we look at what people tell us about their symptoms, Jews are somewhat more likely than the American public as a whole to say they've had severe symptoms. But bear in mind, these are people's subjective self-descriptions. These are not the judgments of medical professionals. The 8% of Jews describe their symptoms as severe. But if we look at the less severe descriptions, we see that they're pretty similar. And overall, the share of Jews who say they've had any symptoms is very, very close to the share of the US public that has had any symptoms. There is, sadly, one measure in which Jews really do stand out, and that is a higher share of Jews who say that they personally know someone who was either hospitalized or died in this pandemic. I think it's important to note, though, that Jews are disproportionately concentrated in urban areas and in the Northeast, including the greater New York City area, which was hit particularly hard in the first months of the pandemic. So these proportions could look different if we did the survey today or in the future as the virus continues, unfortunately, to take its toll in other parts of the country. And with that, I'd like to turn the virtual microphone over to my colleague, Dr. Becca Alper, to discuss the economic impacts of the pandemic as measured in the same survey among 13,000 US adults, including about 350 Jews.
Thanks, Alan. You can go on to the next slide. So the survey also asked questions about the financial impact of the pandemic. And in some key ways, the economic impact of the pandemic has been about the same for Jews as it has been for the public overall. About 4 in 10 Jews say they or someone in their household has lost their job or had to pay cut since the outbreak began. And this is virtually the same for US adults overall. 3 in 10 say they have used savings or a retirement account to pay their bills, and 1/3 of the public says the same. You can see about 1 in 7 Jews say they have gotten food from a food bank or a charitable organization since the start of the pandemic in February. And 13% say they borrowed money from friends or family. And this is on par with the share of these adults who said yes to these 2 questions as well. And you can see that relatively few Jews and US adults overall report saying they lost their health insurance since the coronavirus outbreak began. Next slide, please. Thank you. But in other ways, Jewish adults in the US have suffered less than other Americans from the financial effects of the pandemic. 1/4 of US adults say they have had trouble paying their bills since the coronavirus outbreak began in February, compared with 9% of Jews. US adults have also struggled more with paying their rent or mortgage and paying for medical care. And the public overall is more likely than Jews in the US to say they have received government food assistance, such as SNAP benefits. Next slide, please. At the same time, 1 in 5 American Jews say they've received unemployment benefits since the start of the pandemic in February, compared with 15% of US adults. So you can see this is the one part where Jews are drawing from benefits different from US adults overall. This was just a very quick snapshot, if you will, Alan, next slide, showing some big picture effects of the pandemic. Overall, we can see that the pandemic has hit Jews hard. Health-wise, Jews have been hit about the same as the public overall, with 16% saying they think they've had COVID-19 or tested positive for it or had antibodies. Economically, Jews have also been hit hard, but a little bit less bad than for others. So for Jews, they may have been potentially cushioned by having higher than average household incomes in the US and educational attainment. These data really only allow us to scratch the surface of how Jews may be affected by the pandemic. And so the other panelists will hopefully be able to shed more light on more of the experiences going on amongst the Jews in the US in particular. Thank you.
Thank you very much, Alan and Becca. I think Janet is coming onto the screen soon. Janet, before you start, just a quick word for all of our participants. We will be making most of these slides available after the GA. I've gotten a couple of questions about that already, so hopefully we'll be able to make them available to you. Okay, I'm going to turn things over to Janet.
Okay, and my screen is up?
Yes, your screen is up. You're good to go.
Okay, thank you. Thanks, everyone. And that was a great introduction to what I'll be talking about. As Lawrence mentioned, this is I'm presenting results of a survey that we did at Brandeis of 10 different Jewish communities about their response to the COVID crisis as it unfolded. I'll just talk a little bit about the study. We had about 14,000 respondents in the 10 communities. Unlike the data that Pew collected, this was not necessarily representative of the communities as a whole. All of the participants were chosen off of lists of from community organizations. So it tended to be more people who were more engaged Jewishly than the community as a whole. Nonetheless, we have a diversity of age, as is shown here, and economic situation, which is what I'm going to be focusing on. We found that about 11 or 12% of our sample reported that prior to the pandemic, either they were just managing to make ends meet or they could not make ends meet. I'll be talking about this group quite a bit, and we're going to call this group together as those who are economically struggling. So also for context, just want to keep in mind that these data were collected in the 10 communities from the middle of May to the end of July. So a little earlier than the Pew study was. So I'll be focusing on 3 topics: the financial and emotional well-being, about the role of Jewish organizations, and online Jewish life. There was so much more in the survey, so these are just highlights to give you a taste of what we've learned. The first thing I want to talk about is the financial impacts, and we looked at it a slightly different way than Pew, and we divided it. We were able to look at what was the impact different people based on what was their financial situation before. And what we can see here is that the people who were struggling before the pandemic, they were more likely, not surprising, to be worried about their basic living expenses. That's the bar to the left, and that's not surprising. But they were also much more likely than people who whose financial situation was better to say that their financial situation worsened and that they lost a job or was furloughed for a job. And most of the other financial indicators followed the same pattern. Those who started off in a more difficult situation experienced the most difficulty. So it was not just financial issues, but we also asked about the emotional impact. And we saw that people who were struggling financially prior to the crisis had the greatest emotional difficulties at the time we were taking the survey. They reported that emotional or mental difficulties hurt their ability to live their day-to-day life. And they also reported higher degrees of loneliness. More of them were lonely more frequently. Then we said, like, what are the explanations? Why are people more lonely or having more difficulties? And one question that we asked was, how many people do you have in your life that you can that you can rely on for support? And it turns out, of the people who were struggling, they had fewer people who they can rely on in their personal support networks. So this may be one of the reasons, an additional factor in their emotional difficulties. We found a sort of a similar but somewhat different issue with young adults, and this issue has gotten a lot of publicity because it's been seen in a lot of national surveys, not just in the Jewish community, that we asked the same questions. How often did you feel emotional or mental difficulties, and how often did you feel lonely? And in both of these, young adults under age 35 were much more likely to report these experiences. However, unlike with the financial situation, we actually see that young adults have stronger social networks. They are more likely to say that they have a lot or a fair number of people that they can report, that they can rely on. So the explanation about why they are struggling emotionally, it's not because of their lack of social support. And we need to dig deeper to see what is going on, what is the experience of young adults. Another category of concern, parents and children. Now, parents and children, we asked them about how are you coping and how are your children coping. The majority of them said that they and their children were coping pretty well or very well. However, we also asked, how concerned are you about your child's emotional and social well-being? Parents of all ages, pre-K, K through 12, and college students the majority are somewhat, and quite a few are very concerned about the social and emotional impacts of the pandemic. Now I'm going to move on to the role of Jewish organizations. We asked about how, and remember that everybody in our sample was on at least one mailing list for a Jewish organization. And we asked people, have you heard from a Jewish organization in this variety of ways? Did they offer you assistance? Did they ask how you were doing? If you were a synagogue member, we asked about your synagogue. If not, we asked everybody about other Jewish organizations. And this bottom row is the people who were not contacted in this way. So 36%, a third of people, said that they were not contacted by any Jewish organization at all in any of these ways. 75%, 3/4, said they were not offered assistance by any Jewish organization, and so on down the line. In terms of synagogues, we asked if people plan to change, this is of synagogue members, if they plan to change their membership. Here again, we saw strong economic impacts. So the people who were struggling prior to the pandemic, half of them don't expect to change, but a quarter of them will only change if they get financial assistance to retain their membership. Last topic I'm going to go on to is a really interesting one about online Jewish life. There's been a lot of talk about how people are engaging online. One of the big questions has been, have we brought in new audiences? Now, just like many of you watching this might not have thought to attend the GA in person, but the fact that you could do it from home remotely, and the fact that there was no charge to do it might have gotten you to attend for the first time. So there's a lot of questions about that in Jewish life in general. And we found that, in fact, online Jewish life did not attract people who had never done in-person Jewish life. So here we see that at the bottom, it's how often did you do a Jewish program before the pandemic? People who said, I never did a program before, nearly all of them said, I never did a program online either. In contrast, the people who said I did programs all the time, at least once a week before the pandemic, more than half of them said I did an online program often in the last month. So the bottom line here is that online Jewish life appears to have attracted, have fulfilled an important need for people who were engaged to help maintain their engagement, but it didn't attract new audiences. And then we asked people, what did you do? Did you do new things, or did you just replace what you were doing before? And it turned out that the majority of people, this is depending on how often they did anything online, and the patterns were all the same. The most common activity was a new program. Second was accessing new resources. The third was reaching a new community. And the smallest was reaching new people. So here again, we see with online Jewish life, it maintained connections to programs and activities, and even expanded them for people who didn't participate before, but it didn't build community and it didn't build interpersonal connections. Those who participated in online Jewish life were highly likely to say that they expect to do so in the future. And the more often you did something online, the more likely you were to agree. So I think that online Jewish life is clearly something that is here to stay. And with that, I just want to acknowledge all of the federations who participated in this study and the funders of the study. And thank you very much.
Thank you very much, Janet. We are now going to move to Chicago, where Sabrina Townsend, as I mentioned before, Sabrina and the Chicago Federation participated in the Brandeis study. They were one of the 10 communities. Sabrina is going to speak about how they're using those data and some other research that the Federation has been conducting. Thank you, Sabrina.
Great, thank you so much, Lawrence, and thank you so much, Janet. I will be talking about how we in Chicago have been utilizing the findings from the Building Resilient Jewish Community Study, as well as some other research that's taken place since March. So when you visit the JUF Chicago website, this is what you see. There's detailed information for those looking for help or to make a donation, and strategies to connect with others. There's also a summary of how JUF has accelerated human service delivery throughout our community, swiftly meeting emergency needs wherever help is necessary. As of October 12th, we've allocated $14.7 million for financial assistance, health and safety, organizational stability, extraordinary social services, and food assistance. Since April, these allocations
Hi, Sabrina. It seems like we may have lost you on the audio and video. Maybe try turning off your camera for the time being and see if that helps. Yeah, it seems like we, unfortunately, her internet might have disrupted her presentation.
Alex, have we lost Sabrina?
Yeah, we did. She completely disconnected, unfortunately. I'm sure it's momentarily and she might be rejoining, but perhaps
Okay.
we could go to the next person and get back about her. Is that a
Uh,
possibility?
yeah, I'll just a few while we're waiting. Perhaps she'll be able to join us back in a minute. While we're waiting, just a few things for our participants. Again, if you have questions, please use the Q&A function at the bottom of your screen rather than the chat function. If you can do that, that will certainly help us out. And second, I did chat out to the entire webinar the URL for publicly available information from the Brandeis studies. So there is quite a bit that's already available. And if you're interested in exploring some of the results of the study, you can check that. Okay, I think Sabrina may be trying to rejoin us. Hang on.
I did just rejoin. I'm so sorry about that, Lawrence.
Okay, terrific. No problem. This is the Zoom error. We're used to it.
It's something, especially when you're in the middle of presenting. You don't realize that no one can hear you speaking.
Right.
All right, so I think I'll just pick up where I think I left off, but I don't want to run the risk of repeating myself either. So what I think I'll do is I'll just start with sort of where the story begins in terms of the organizational needs assessment work that we've been doing. So starting with, I'll take us back to the month of March, when the state of Illinois released the stay-at-home order. JUF took two important decisive steps related to research. First, we pushed pause on our plans to begin data collection for our own 2020 community study, literally days before the invitation letters were scheduled to go out into the mail. Second, we mobilized to conduct an organization needs assessment, but we didn't do this work alone. JUF joined with other local funders to develop a set of key questions. And since March, we've been continuing to work with these funders to survey the community and use this data to guide our collective planning and allocations. To date, we've heard from 140 unique organizations, which is more than half of the ecosystem here in Chicago. At first, we received surveys from 97 organizations in March. And with each snapshot, the survey response grew. We continued to hear from largely the same organizations in July, which deepened and clarified our understanding of what still needed to be done. And by this time, we started to also hear anecdotal feedback from our agency and community leaders that JUF did something with the information, which is why they were always making sure to respond. These organizational survey responses directly informed our COVID grant making. Based on the responses we received, we're now providing grant support to more than 75 organizations, many of which had no formal funding relationship with JUF in the past. For long-standing partners, we use the information they shared in the spring to advance allocations through the end of the fiscal year to help with cash flow. And based on overwhelming need for PPE at the beginning of the pandemic, JUF negotiated joint purchasing rates with reliable vendors and launched a new website to support that process. Today, we're continuing our partnership with the funders to build on what we've learned so far, and so that we can learn more about, literally what don't we know yet and how can we best respond. In addition to all of this information that we received directly from the organizations that we support, we knew how important it would be to hear directly from community members. So when Janet Aronson and Len Sachs at the Cohen Center shared the idea early on for the Building Resilient Jewish Community Study, JUF did not hesitate. As part of our own work for the community study that we were planning, we had already assembled a huge list of known Jewish households, including email addresses. We utilized a subsample of email addresses to reach out to the community to understand how their lives have been impacted by the pandemic. Data in Chicago was collected in June from over 1,400 individuals, And the results were made available by the Cohen Center in August. So we were able to quickly disseminate this information to all of our organizational partners. Based on those top line results and early presentations and discussion, two overarching issues emerged. Both I think that Janet has already touched on today: the needs of young adults and the mental health challenges that all are facing across age groups. So in addition to emailing the key findings and the top line results to our community partners, we scheduled a separate session to have the research team, so the Cohen Center, came and directly focused on the needs of young adults ages 21 to 40. And right away, it became clear in that conversation that we needed to coordinate a few more discussions to really dig in. Prior to the pandemic here in Chicago, we had already had a group of organizations coming together to talk about the needs of young adults, known as the Young Adults Roundtable. So these same organizations were invited to meet with us to dig in. The results just made it very clear that this population, young adults, are not coping well. 1 out of 5 had indicated that on the BRJC study. 60% or 3 out of 5 feel lonely and have experienced emotional difficulty. We learned that while 2/3 feel connected to a worldwide Jewish community, they were less likely to say that they feel connected locally here in Chicago. 60% feel part of a virtual community, even if it's just a little bit, and 75% agreed that having access to a virtual community helps them to feel connected. But when asked if they've done something online in the last month, only half indicated that they had done so. So while focusing on just the young adult population, we broke the data down into even more bite-sized nuggets, organized around 3 themes, and we held 3 separate conversations with those young adult organizations. Coping and Moping, where we examined the financial, employment, and emotional needs of young adults. Physically distant, yet socially connected, where we discussed organizational involvement, connection, and online Judaism. Tikkun Olam, where we explored the top causes and concerns of young adults, volunteerism, and philanthropy. For each of these conversations, the format was the same. It was on Zoom, but it was 15 minutes of data followed by 45 to 60 minutes of design thinking. The other major issue identified by BRJC, our organizational needs assessment, and pretty much every other source of input, is the present and looming mental health crisis. On October 21st, just days ago, we facilitated a community conversation with over 60 staff from these 16 organizations to consider what more we could be doing together to increase social connection, reduce isolation, improve mental health, and enhance community capacity. With funds set aside by the COVID-19 Initiative Committee, we asked that everyone come together to explore how might we. We used this session to generate ideas, and my colleagues are now working to collate all of the input received and develop our next steps for the coming week, I would say. So in conclusion, I just want to share that our research continues. Based on what we learned from the BRJC study, we made very important modifications to our own community study questionnaire and decided to go into the field this October. So we are now in active data collection for our community study and using this as an opportunity to follow up with those who responded to the BRJC survey in June. This data, as well as the more immediate November organization needs assessment that we are planning with our funding partners, will continue to inform and guide our next steps for the months and the years to come. Thank you, and please excuse the technical difficulty.
Thank you very much, Simrita. That was very, very informative, and it sounds like you've been able to really put the Brandeis data to good use so far, as well as your own organizational assessments that you've been conducting. We're going to switch locations now and move to Philadelphia, where Brian Grolnick from the Jewish Federation of Greater Philadelphia will be speaking about some of the on-the-ground responses that the Federation and his department have been implementing in response to the pandemic. Thanks, Brian.
Great, thank you, Lawrence. I think to some extent you can really put any federation here in sort of the remarks that I'm going to give in terms of the responses that we've been having as a community. Before I sort of get into some of the details, I just want to provide a little bit of background that I think will be helpful, that will sort of give you an idea of where we were coming from in part of in terms of our response to COVID. Some quick facts, one of which is that the Greater Philadelphia Jewish community is on average one of the oldest Jewish communities in the country. If you sort of omit sort of the sunset, the retirement belt, we are really one of the oldest communities. The other thing that's really important is that we had just completed our every 10-year community population study just a few weeks and months before COVID and the shutdown really impacted everyone. We were out in the field with that study for a good portion of 2019, and it had a really large sample size of about 2,300 individuals. And I think one of the things that's great about this discussion is that data from our population study, which we're really not going to get into in this session, but some of that data was sort of reinforced by some of the research that you're going to hear from the next participant, from the next panelist as well. The other thing to keep in mind is that we have a significant amount and emphasis on food security, but much of that work is done by volunteers in a few different programs. We have a senior center that does a sort of Meals on Wheels program where 40 different volunteer cooking groups, most of which are either sort of synagogue-based or sort of Hillel and college-based, are making meals and then being home delivered to volunteers, along with sort of the food pantries and other programs that are a little bit more typical. So when COVID hit, we were dealing with some agencies, some social service agencies in Philadelphia that quite frankly are already a little bit risk averse, and really to their credit, some of the agencies shut down a week or two earlier than some of the secular social service agencies did in terms of senior centers and in terms of working remote as well. The other thing I think which is interesting to keep in mind, I do a lot of work, and I'll talk about that in a few moments, with sort of the secular philanthropic community, and I think that the Jewish federations overall are in a better position to respond to pandemics, to emergencies, than some of the other sort of more community-based or your more United Ways or archdioceses. Obviously, that is because we are unfortunately responding frequently to crises and emergencies in Israel, but even sort of domestic issues, as other panelists have mentioned, flooding as well as something that other federations have been activating their emergency response committees. So when the pandemic hit, like most federations, we opened a mailbox and started getting a significant amount of donations in. Our Emergency Response Committee, which is a standing committee of the Board of Directors, staffed by a member of the Board of Directors, chaired by a member of the Board of Directors, and staffed by my supervisor, the Chief Planning and Strategy Officer, and the head of sort of our grant-making processes. Other individuals on that committee are the two immediate past presidents of the Jewish Federation, the head of our planning and allocations, and a few other lay leaders as well. So very much, a robust group that is very knowledgeable about, not just research, but sort of the reality, research and the reality of what's going on in the ground here. And sort of, as you can imagine, like other federations have done, we try to put a fair amount of cash sort of into the street, if you will, for lack of a better word, for a very Philadelphia street word, if you will. So we very quickly turned to Jewish Family and Children Services and provided them with bridge grants and critical care grants so they could help individuals with a rental payment. Rent obviously in Philadelphia and in Pennsylvania with the rent moratorium, something we're looking very closely at, the eviction moratorium. But other payments, whether or not it's a medical copay, a utility payment, sort of the basic sort of household living expenses that individuals, pre-COVID, unfortunately, are struggling with. We sort of recognize JFCS as obviously, in our community, the best agency to provide that type of assistance. We also provided assistance and provided critical needs grants to other agencies that were working with individuals and families who had a child on the spectrum or living with a diagnosis and needed some additional dollars for education or other types of subsidy, other types of childcare support, respite support for the family members as well. And I just want to pause here for a moment, because at Jewish Federation in Greater Philadelphia and sort of the communal agencies in Philadelphia in general, we have spent, years looking and thinking about essentially how we would give out cash, into the community. And of course, it's not like, we're not necessarily handing, an individual, a check. Sometimes, we're making that payment on their behalf to, the entity that they need to get paid. The mortgage company, the utility company, the hospital, the insurance company, etc. And we, have done a lot of work to try and figure out, which agencies are providing which dollars to which individuals, and trying not to provide sort of a gotcha game to saying, oh, you went to this agency and that other agency for cash assistance. Yeah, because you know what, sometimes people are, more than 1 month behind on a payment, so it makes sense. But just to get sort of a collective impact and a sort of totality and a complete picture of what we're doing, we have traditionally looked at Jewish Family Children's Services in Greater Philadelphia as the agency that is most comprehensive in its sort of assessments and its care management when giving an individual $500, $1,000 to provide assistance. Some of the other things that we've done, sort of as you would expect, we provided a lot of grants for food insecurity to our food pantries and to our Meals on Wheels programs and to a handful of other agencies. Our Federation Housing, which is providing affordable senior housing to over 1,000 households, and we've been providing congregate meals there for many years as well. Our Jewish Federation has a real estate affinity group that raised dollars and granted some of those dollars not just to our sort of typical Jewish communal agencies, but also to the Restaurant and Hospitality Workers Fund, a very secular entity, but very much individuals in our real estate group recognizing that people in the hospitality and restaurant industry very much impacted by COVID, a little bit more so than some of the other industries. Another thing that we did, which again was really modeled on work you're going to hear about in a moment, is that we made a $250,000 sort of block grant to 90 congregations and synagogues and gave those rabbis at those 90 synagogues a few extra thousands of dollars to enable them to sort of boost up their rabbi's discretionary fund, because we know in sort of a time like this, where things are, really so dire, we really wanted to try and be creative in terms of giving individuals assistance. One of the things that, we'll hear again in about a minute that was really, clear in our 2019 POP study is that there are a lot of the overwhelming Jewish community in Greater Philadelphia in need is not coming to Jewish communal services, social service agencies. So we are really looking to try and be sort of as broad in our reach as possible, but it is, still we have a fair amount of work to do, which is I think why we wanted to connect with the rabbis and the synagogues. But again, that is still, relatively low-hanging fruit. The other entities that we were active with was our kihilas, which are sort of neighborhood and geographical based convening bodies of synagogues and communal organizations, and they were very helpful as well in terms of getting the word out and sharing resources. Some more Federation typical stuff that we were doing is we were convening all of our communal agencies on a weekly basis, and then the community at large. All of the social service agencies were being convened under my direction every other week, and then that eventually moved to every 3 weeks. But we were sharing information about different resources, talking about the needs for, at the early onset, more surgical masks and sort of entry-level PPE, if you will. Also trying to provide as an organization resources for the CARES Act, whether or not that's through people we know in the banking community or in accounting or in other areas, to make sure that our agencies were really well positioned to try and take advantage of that federal funding as well. Another area that I want to just mention is that I was very active in sort of liaisoning with the more secular philanthropic community in Greater Philadelphia. There's an entity called Philanthropy Network, used to be called Delaware Valley Grant Makers, which is a little bit more indicative. But Philanthropy Network is essentially the JFNA for the secular philanthropic community in Greater Philadelphia, and they were convening calls on a weekly basis. And I think one of the things that we were, that I personally am very mindful of, that they did some research, particularly from the Center for Disaster Philanthropy, and they found that about 2/3 of private giving happens just in the first 4 weeks of a sudden disaster, and 2/3 of giving happens within 2 months, and then virtually all giving stops. And that should be, very concerning to, all of us on this webinar, and all of our, other communal professionals. So Jewish Federation is partnering with an entity called the Center for High Impact Philanthropy at Wharton, which is creating a COVID dashboard for all of the COVID funds in Greater Philadelphia, faith-based, secular, United Way, et cetera, so that we can sort of see as a community, where are our dollars going, where are they not going, and which communities, do we need to reinforce some additional supports for. And then, of course, I was sort of liaisoning that information with our emergency response committee in terms of what other grant making entities were doing, and then with our grantee organizations as well, whether or not it was about, grant deadlines that were coming up or grant opportunities as well. And then 2 other things I just want to mention as well is that we did do 2 surveys that were run by our internal evaluation department as well, which were sort of similar, and the findings were similar to those that were discussed here. I believe the MC put in links to Philanthropy Network and our Jewish Federation survey as well, but our internal survey was conducted with a methodology similar to that of other studies mentioned, the Brandeis study, and it was not a representative sample. We had about 1,000 individuals participate, but we also did an organizational survey as well. We had 49 communal agencies participate in that survey. You can go and click the link and look at some of those survey results. One of the things that I think was a little surprising to some is that when we compared sort of the impact and the response to COVID from social responsibility or sort of social service agencies versus sort of those agencies in sort of the life and learning bucket, the day schools and camps, it was the day schools and camps and sort of the Hillels that have had and are having a harder time sort of adjusting and sort of modifying their business than some of the social service agencies. So that is something that we're definitely looking at and thinking about as well. Those chats didn't come into the chat room yet, but I will put them in. One other thing that I'm just mentioning about that I just want to mention about is that, throughout this, time, we have spent a lot of energy around mental health. We don't have, great answers to that immediately. We are, concerned about the mental health for our entire community. We did see, interestingly, in our 2019 population study, which we call Community Portrait, that younger adults were much more likely than older Jewish adults to report having or struggling with mental health or depression as well. So sort of similar, the prior or the Pew study results as well. But specifically on mental health, one of the things that I know our communal agencies have been doing is really looking at telephonic sort of check-ins and telephonic assurance. One of our programs called a NORC, a Naturally Occurring Retirement Community, had a Phone a Friend program prior to COVID that was helping around 12 people. And then through sort of the bully pulpit of our weekly communal calls, we were able to rev up that Phone a Friend program and recruit volunteers really throughout the Jewish community, young and old, and we wound up having about 100 unduplicated volunteers on a weekly basis calling 100 clients and sort of checking in with them and just providing some sort of reassurance. I'm pretty proud that in a relatively short amount of time we put together about a 12-minute training that was on YouTube that the Maryland Department of Maryland, a area agency on aging in Maryland saw it and started using it for their training as well. But some other areas I just want to mention as I just sort of conclude my remarks is that both sort of what the 2019 POPs community portrait showed, along with I think what a lot of the data is showing now, is that Jews of color are a particular demographic, and people of color in this pandemic are particularly impacted. And I think that's still an area that we as a Jewish Federation need to work on as something to focus on in the next few months in terms of the impact it's had, particularly on Jews of color in greater Philadelphia as well. So I'll just turn it over to Lawrence and sort of hear some of the back end of not necessarily back end, but hear about sort of how people are now being impacted by sort of the response of our communal agencies.
Great, thank you very much, Brian. Sounds like the Philadelphia Federation has been quite busy and doing good work. We're going to turn over the last presentation from Alana Horowitz. Alana has been conducting, she'll tell you more, but she's been conducting interviews in Philadelphia among Jews in the city and has some interesting things to tell us about how those Jews have been managing to access many of the services and provisions from the organized community. Thank you, Alana.
Great, thank you, Lawrence. So I, back in the summer, became really interested in how Jewish adults, specifically, I was curious about Jewish parents, were actually weathering the economic hardship of COVID. And I come at this from an academic perspective. I'm a sociologist of American Jews. And so I'm going to layer a sociological lens on top of the previous, I guess, 4 presentations and offer a concept that I call social capital to help us understand the demand side of the services. So Brian, who was actually a great partner for me in making my work possible, talked about the supply side, right? So the Federation supplied these funds through different organizations like Jewish Family Children's Services. And I was curious, how did families actually access these services? And who had access and who didn't? And so the question I asked, which is the title of the presentation, is how do social ties, which I'm going to call social capital, help lower income Jewish parents weather the economic hardships? And what I'm going to tell you over the next 10 minutes, in case you sort of need to get going, the main argument I'm going to make is that yes, social ties absolutely helped low income Jewish parents weather the economic hardship. However, not everyone had the right kind of social ties to get linked with those kinds of resources. So how did I come to find that out? Between August 16th and October 2nd, which was about a 6-week period, I conducted interviews with 36 Jewish parents in the greater Philadelphia area across all of the different counties, but about half of them came from Philadelphia specifically. And I focused the sampling on parents who had a combined household income of less than $75,000. You might be asking yourself how I chose that number. The median household income in Philadelphia is about $75,000. And so that was my cutoff. You might be saying to yourself, well, you probably got a lot of families who are middle class. That doesn't sound so poor. And you're right, about 11 of my 36 families, I would say, fell squarely into middle class status. And then the other 25 were low income. And so they generally were earning less than $40,000 for their entire family. And right now, for the next 7 minutes or so, I'm really going to focus on the low income families that I spoke with. Also, to make it into my sample, a parent had to have at least one child in the K-12 system. I wanted to understand how, during a time when there was economic precariousness, how people were feeding their children and taking care of their children. And then, just to give you a sense of who ended up falling into the sample, 4 out of 10, 40% of the parents I spoke with were single parents, mostly single moms. And then 40% were Orthodox. In some cases, the single parents were also Orthodox, and in some cases they were not. But just to give you a sense of the kinds of people I spoke with. So I'm gonna share with you a story of Tanya. In my paper, which I'm happy to share with you, if you email me, there are a lot of stories, a lot of narratives. Some are very heartbreaking, but I will just focus on Tanya as the prime example. She works part-time. She lives in Northeast Philadelphia. She works part-time as a teacher at a school and then part-time as a babysitter. And she is a mother of 6 children. She is ultra-Orthodox. And she and her husband is a food distributor, both have low wage jobs. And by the way, my data very much align with what Pew found and what Brandeis found, that low income Jews were absolutely worse off economically during COVID. In my sample, 60% had suffered economically because of COVID, as opposed to 18% of the middle class parents. So low income parents absolutely were struggling the most. And low income parents were the ones who were least likely to have rainy day funds set aside to pay those bills. And so where do they turn? So Tanya is a woman who couldn't turn to her family or really her friends for help. But here is actually what she shared with me. She actually was faring quite well. And so she said to me, there are tremendous resources that we had available to us during shelter in place. I'm so thankful for them, the Jewish Relief Agency, which is one of the organizations that Brian may have mentioned that got the Federation funds. The JRA was able to drop off boxes to people's houses and supplement with supermarket gift cards. The rabbi of our shul was able to help people with different things. This is what Brian referred to when he talked about 90 congregations receiving discretionary funds. That is what she's mentioning here. There were a lot of resources, Tanya says, available to help people because everybody was just in such a desperate situation that anybody who could help with different things in the community really did. It really shows how people were able to come together and do that for each other. But how did Tanya even know to access those discretionary funds? What made it possible for her to get linked with these services? So here I'm going to get a little academic on you. I hope you'll bear with me. So I'm going to introduce this idea of social capital. Social capital is basically, it exists in the relationships that we have amongst us and the people around us. It exists in the relations between and among people. And it stands for the ability of actors to secure benefits by virtue of membership in social networks or other social structures. So social capital is not the property of individuals. Like, I don't necessarily have social capital, but they're between me and my different social networks. It could be friends, it could be colleagues, it could be me and my Jewish community. There are norms and trust that flow through those relationships. And so there are different kinds of social capital. There are 3 kinds. I'm going to tell you what those 3 kinds are, and then I'm going to focus on 2 of them. So there's bonding social capital, and you'll see this plays a really big role in this story. Bonding social capital refers to the relationships among members of a network who are similar in some form. So a specific example of bonding capital would be that if you are Orthodox, you are probably living under an Eruv and deeply connected to other people in your neighborhood, right? You're having Shabbat meals together. That is a form of bonding social capital, right? Those people are similar to you. Family is another example of bonding social capital. A second type of social capital is bridging social capital. And these are relationships among people who are dissimilar from us. So this is people who are maybe of different racial and ethnic backgrounds, people of different economic backgrounds. So this would be an example, right? Like, I go to college and I meet people who are of a totally different social class status than me. That is a bridging form of social capital because maybe I can rely on them one day to connect me with someone who they know to help me get a job. That's bridging social capital. And bridging social capital actually did not come up as as playing an important role in helping families. So this is really the only time I'm going to mention it. The third kind is linking social capital. So whereas bonding and bridging sort of happen horizontally, they happen across people in your social networks. Linking social capital happens vertically. You get connected to people who have more power or more authority than you. You get linked to institutions or individuals who can provide you access to resources. So let me give you another example from a quote from one of the people I interviewed of what bonding capital looks like in real life. So she mentioned, this woman mentioned, I'm a big part of the school. I'm active in a lot of different community organizations. My husband runs a father-son learning group. I do meals for people that just moved in or people that have a baby or people that are going through something. I run a mitzvah meal program. I'm also part of the Chevra Kadisha and I'm part of fundraising for the Mikvah Association here. My husband's on the board at the shul. We're ingrained in this community. We do a lot. We're invested in it emotionally, physically. We believe in it. Whoops, sorry. So this is how bonding capital circulates. This is how people form bonding capital. You can't just go to an organization. You can't just like do PJ library, for example, or go to a synagogue service and pray and not have any social interaction. That's not how you build bonding capital. You have to engage in a reciprocal manner with a community in order to develop those networks where those norms and trusts flow. Now let me give you an example of what linking capital sounds like, and then I'll show you how they relate. So one woman I spoke with said, we had a crisis in our home about 1.5 years ago, a mental health crisis. And we needed a little bit of support during that time. And my friend said, listen, I'm calling the Rav. Are you okay with that? And I'm like, yeah, sure. I probably wouldn't have made that phone call. But the rabbi was like, I'm sorry, I didn't know about this sooner. What do you need? And what she needed at the time was a couple $100 so that when she went to get mental health support, someone could help her husband take care of the children. But what is the linking aspect of this social capital is the fact that that rabbi was able to say to her, what is it that you need, right? He was able to provide her material resources. But this woman, Orit, she needed bonding capital to connect her with that rabbi, meaning her friend said, listen, I'm going to call the rabbi. And the woman, Orit, was like, oh, I wouldn't have done that myself. So essentially, Orit had the bonding capital with her friend, which linked her to the material resources. This is how capital flows. And here's how it actually provided material resources during COVID. Bonding capital on its own was actually minimally helpful because in bonding capital, it's a lot about like relationships, right? In your neighborhood or with your family. But during COVID, social distancing prevents us from actually having physical contact with people. So like during hurricane, like let's say during natural disasters, heat waves, right? People look to their neighbors to help them. During Katrina, neighbors literally like took a boat and they rowed over to their neighbor's house and they helped them. But during COVID, you actually can't rely on any physical support. You can't have somebody come and watch your children. But what bonding capital did do was that it linked people to resources. It facilitated linking social capital, which is what provided parents with material resources. And so here are just two quotes of what that sounded like. Elisheva, a single mom, told me there were a number of pieces of money floating around in the months following shelter in place. The rabbi kept calling and he said, do you want $1,000? You don't have to pay it back. And then she also mentioned how she got all these different ShopRite food gift cards, and this came up over and over again. And then Orit, who I mentioned in the previous example, who was having the mental health crisis, later on during COVID, she said, the rabbi calls me every now and then and says, how are you guys doing? With a pandemic, if you ever need any money, let me know. So she had already developed this relationship with him and he now knew to reach out to her. But not all parents in my study had access to bonding capital. And they were not able to receive material resources from Jewish organizations during COVID. So one example was a woman who lives in Northeast Philadelphia. She was really struggling. She ended up going to work at Wawa to help support her family during the crisis as a second job. And she actually she in college had gone, she had Jewish friends, she had gone on Birthright, she had done the METWAR program, but she wasn't part of a Jewish or any sort of Jewish organizations in Philadelphia. And she didn't have that sort of reciprocal nature with anybody. And so when rabbis got their discretionary funds, they didn't even think to call her because she was not on their radar. And so I'm going to wrap up and I'll tell you the key takeaways. First, parents can tap into this bonding capital when they're active in Jewish social life. So it doesn't rely, you don't have to be religiously involved, but you have to be involved in some social life. I talked with parents who were, across all forms of sort of the religiosity spectrum who had high levels of social capital. You don't just have to be Orthodox, but it does happen to be that the Orthodox families are more involved in the social life of their communities. 2, bonding capital facilitated linking capital, which is what yielded the material resources to low-income parents. And then 3, this is a new point and an important one as we think about the long-term effects of the pandemic. Social distancing can actually threaten social capital. If you think about how social capital works, right, how does it circulate? People have to be active and out and about and volunteering in their community. And during a pandemic, right, everything shuts down. And so whatever people were doing for each other and whatever ways they were supporting each other actually can't happen. And so the long-term effects of social distancing actually threatens this flow of social capital. I'm happy to share a copy of this research paper. Please email me. I'm not able to publicly post it at the moment. And thanks so much. I welcome any of your questions.
Great, thank you so much, Ilana, and thank you to all of our panelists for the information that they've shared with us today. We do have a little bit of time still to take some questions. So we've had some questions coming in the Q&A function as well as a little earlier in the chat. So I'm going to select some of these questions and we'll direct them. Most of them are directed to a particular presentation. So I will let the presenters know who I'm directing the question to, and then they can kind of come back on screen and answer. So our first question that came in was about the Pew Research study. So for Alan and Becca, the question was there anything particularly noteworthy about the fact that Jewish respondents have higher rates of unemployment benefits and lower rates of needing other forms of aid, like receiving food from food banks? Did that strike you in any ways as particularly noteworthy about the Jewish experience during coronavirus?
Becca, are you on? Do you want to take that?
No, you can go for it.
So we don't know. And I think it's difficult and probably unwise to speculate greatly about it. It's possible, that because Jews maybe entered the pandemic with a little bit higher levels of socioeconomic status. So higher levels of employment, higher levels of income, higher levels of education in general. That they may have been more likely to be employed and then more likely when they lost employment to then actually receive benefits. That's a possibility. That's really all I can think to say. Becca, your thoughts?
I mean, unfortunately, our data can't really speak to that part of it. We just don't have enough on it. But I would say perhaps some of our other panelists may be able to speak to it a little bit more with things you found out.
Thank you.
Thank you. Okay, we had a question coming in about the study from Brandeis. So Janet, this one is for you. The questioner writes in, with respect to the engagement findings, can we conclude, so this is going to be a little bit of trying to infer some things from your findings, so not necessarily straight from the data itself. With respect to the engagement findings, could we conclude that the issues that we think have kept people away in the past, pre-COVID, so things like distance and cost, were they just excuses for not participating? And should we be focusing more on those who are already engaged? Or does it mean that we need to keep coming up with better ways to engage the unengaged?
Those are great questions. And I think there are a few questions in there. I'm going to try to split them out. As far as the first part, the excuses, we did find, and I didn't show it here, we actually did find that there was a small financial impact that lower income people who were engaged before the pandemic were more likely to participate in online Jewish life. So I do think we have some evidence, and we haven't fully unpacked it all, that that this actually, we are meeting some needs of people who wanted to be engaged but couldn't afford it. And maybe now that this is a new incentive to participate. So that's something, I think, a really interesting finding that we can dig into. I think it's really hard to tell about reasons that people are choosing to participate and not, because the world is so upside down. I think some people have way more time on their hands. Some people have way less time on their hands. Yes, we don't have to travel to get places, but there are all sorts of reasons that maybe didn't even exist before about why people are choosing to do online Jewish life or not. And we haven't even dug into those. So I think I'll say to Alana, I think that this is a great place for qualitative follow-up to dig into what people are doing, which is how all of this work should happen, that the surveys kind of show you the trends and then the interviews show you the why. I do want to say something about the second part of this question about engaging the unengaged. I want to emphasize, and maybe this is sort of my own soapbox, but it's something we see in the data as well, that these online efforts are extremely important for maintaining connections to Jewish life of people who are engaged. I think that I would never want people to take away that we should abandon those efforts because we're not reaching the unengaged. I think that would be a real shame, and the people who are doing it are really getting a lot out of it. What I'd say is it doesn't solve that problem of how to reach the unengaged. That is a problem that existed before, continues to exist. Mostly people aren't, I don't think that there is enough of innovation in online Jewish life right now that it would tend to reach people who never did it before. We saw examples in our data, for example, people who never went to services are going to services for the first time because they can do it online, but they're not people who were unengaged before. They're just engaging differently in new activities. So I think it's really a challenge to all of you, to the Jewish world, to think about innovative ways to reach people who may not have known about it before. Well, I'll just throw in, sorry to go on so long, but I have a lot to say on this topic. But I'll just throw in what we also found is it's not there isn't a technology barrier, which is what a lot of people suspected. It's not because people don't know how to use Zoom or they don't have internet access. It's not an age. It's not an age issue. People of different ages do different activities, but people of all ages are participating. So stay tuned. We'll have a lot more to learn on this topic.
Janet, I am going to reply. I actually did ask all of the parents that I spoke with about, did they take up any sort of Jewish learning, Jewish content online? Mm-hmm. And overwhelmingly, the answer was no. And remind you, right, I spoke with about 40% of my sample was also Orthodox. Mm-hmm. Parents for my sample had no time to do that, right, with kids running around. And one woman said to me, and I'll never forget this, she goes, there was all this information on my WhatsApp channel from my family about all this stuff, and I muted that channel and I haven't unmuted it since.
Right.
So overwhelmingly, I did not hear of people.
Agreed. Right. And that was a place, I think, I thank you for pointing that out. You're right, that parents did not do this. Parents have no time. And I think now with online school for their kids, the last thing they want to do in their free time is go on an online program, even as a child's family program. Right. Thanks. Thanks, Alana.
Great, thank you. Alana, actually I have two other questions that came in about your research. So the first one is I'm just reading it here, lots of people experienced informal networks in their neighborhoods to deal with cooperative shopping and childcare efforts. Did that surface in your research at all? That's the first question. And then the second was, are people who are working less likely to have social capital since they have less time to spend on community activities? I am assuming that's referring to social capital within the community.
Okay, so to the first one, whether there were informal networks to help take care of childcare needs or food shopping, I did not hear of any of that. It sounded to me like everyone I talked to took shelter in place super seriously and were very nervous. And I did not hear any evidence of that. It may have happened, but I didn't hear about it. And then as to the second question, no. The question was whether working parents, if it's harder for them to develop social capital. So the first woman I talked to you about, Tanya, so she worked half day as a teacher, the other half day as a babysitter. She has 6 children and she had a very, very high level of social capital. She's a very, very busy woman, but she makes it happen. She prioritizes those things in her life to sort of facilitate that social connection. I mean, some of it surely comes right over like the Shabbos table, but no, her and her husband, that is what they do. They volunteer in their community. So I don't think working full-time sort of is a barrier to developing social capital.
Great, thank you. Okay, I think we have time for one more question. I'm going to direct this one back to Janet. Someone is curious about whether if you have plans to refresh your data as the pandemic continues. And I guess I would throw that open to any of the researchers who have initiated projects during this period, whether at the national or local or quantitative or qualitative levels.
We hope to. I think this is primarily a funding and resource issue. So this is a great opportunity for me to say that to this audience. If anyone's interested in pursuing that, be happy to talk about it. We are doing it in some communities, as Sabrina mentioned. In Chicago, we are launching, and a few other cities around the country, we're launching a demographic survey of the general population. And that in some ways will serve as a second wave. So we're matching up people, and we will look at how their individual responses changed over the next 6 months to a year. So that is in the works. In addition, sort of related, but 2 of our surveys, 2 of our participating communities were repeats of demographic studies that we did within the last couple of years. So we're going to be able to do some longitudinal comparative analysis. Lots to learn, lots to dig into, and Lawrence posted our website. So please keep your eyes on that and let me know if you want to be on our mailing list so you can be informed of any new work that we publish.
Thank you, Janet. Okay. I think we're just about run out of time. We're gonna just want to wrap things up. First of all, I want to just a round of thanks to everybody. Thank you to Albert Praw for joining us today as the chair of our session. Also, thank you to our panelists, to Alan Cooperman, Becca Alper, Sabrina Townsend, Janet Aronson, Brian Grolnick, and Alana Horowitz, all of whom were gracious with their time and with their efforts and sharing their knowledge with us today. And just as a final word, just to sort of to put a plug in here as well for the researchers, for those of us who sort of work at the intersection of research, of all different kinds of research, quantitative, qualitative, local, national, organizational, evaluation research, and who work at the intersection of that and of on-the-ground responses, of strategy, of planning, of organizations and agencies who are serving people. I hope the information here we've provided here today really shows the close connection between these two and how the research really does inform so much of what goes on the ground, setting national context and national understandings as well as local and qualitative details of how we do our work. So thank you again to all the panelists. We're going to keep the chat open. I think some of our panelists are putting links into some of their work, so you can be in touch. You can access those works online. And again, thank you very much to everyone for joining us today.
Thank you everybody for your time. The recording is stopping now.